Hey friends, thanks for joining me, Jim Baroud, to hear a few insights from leaders who represent our innovation ecosystem. Today's chat is with Jim Gunton, the co-founder and general partner of Tech Council Ventures, and Nina Tandon, the co-founder and CEO of Epibone.
I am a bioengineer. I am CEO and co-founder of a company called Epibone. Quite simply, we take stem cells and turn them into living bone and cartilage that can serve as skeletal replacements.
Great. And Jim?
We are an early stage investor. We invest in exciting companies like Epibone.
Great. Okay, so Jim, go back to your journey. So from high school and how you got to where you are now.
So I traveled a lot as a child. My dad was a physicist, so we lived in Japan. I was born in Australia. We lived in Geneva. So we traveled around a fair amount. I think the interesting part of my transition to venture capital started probably in my late 20s. I had unknowingly started my career in software. I worked at Oracle in the Silicon Valley. And then I had spent a summer working at an investment bank when I was getting a graduate degree in business. And I thought I'd heard about, and this was back in the early 1990s, and I'd heard about venture capital, and it sounded interesting. So I had the good fortune of talking with John Martinson around 1994, in the earlier part of 1994. And they had interviewed me, but the woman who interviewed me ended up going someplace else, which was to my benefit, because candidly, the interview could not have gone worse. So John reached back out, not knowing that was the outcome, and went from there.
Got it. Okay. And so now you've been doing it for 3 decades now. Is that right? Or
That's right, Jim. That's right. It's been a long time. Been a long time.
Okay. So you work for Edison, and then you started the Tech Council Ventures, or how did that go?
That's correct. So having had the benefit of being, working with arguably the top organization in the region that was doing growth equity, I firsthand, and this was late 90s, early 2000 timeframe, saw the need for early stage venture capital. And so together with Maxine Ballin and Joe Falkenstein, we launched what was then the Tech Council Ventures One.
Got it. Okay, we'll come back to where you're at now. But Nina, tell us about your story.
I started out as an electrical engineer in undergrad. Actually, start at the beginning. I am from Roosevelt Island, New York City, which is a very small part of a very big city. And I think that has really been a theme throughout my life, is finding these little niches within larger, giant, bigger places. And I went to a small girls' school on the Upper East Side called Dominican Academy. I think that's where my love of science was really nurtured. I had some really amazing science teachers in high school, and I also had the chance to take college classes during high school. And one of my favorite teachers in high school was my biology teacher, actually, Mrs. G, who was a Russian immigrant, suffered through the Gestapo, and ended up at this girls' school, and was also suffering from leukemia. And it's from her that I learned about stem cell treatments. She said they were too expensive. She didn't want one. And she ended up passing away when she was 36, when I was a sophomore in college. And I was really devastated. She was one of my closest. She was almost part of the family. And I think that really ignited in me a desire to someday, look for ways that I could contribute to research and ultimately, I guess, get into stem cell therapies myself. But I ended up studying electrical engineering in undergrad and worked as a software engineer. And I think after 9/11 happened, this was in the early 2000s, I started thinking, well, what am I doing with my life? And I started taking community college classes in anatomy and physiology, and just kind of drawing connections that a lot of other people had been drawing at the time, like DNA, that's a lot like a hard drive, or oh my goodness, the same equations that govern signal conduction in a nerve also govern signal conduction in the transatlantic cable. Wasn't that all interesting? And I ended up pivoting and going to MIT to study bioelectrical engineering. And that's where I landed in the lab of Bob Langer. Very entrepreneurial lab, lots of companies coming out of it. And I saw that there was a path in academia to lead to innovation that could ultimately be spun out. And I think before doing that myself, I took a stint. I like to say I'm a recovering management consultant. Worked at McKinsey for a couple of years and got the 30,000 foot view of the industry. But I think all those ingredients kind of came together when I decided to come back to academia, get an MBA in parallel during my postdoc, and ultimately spin out Epibone, which I've now been working on for 9 years.
Wow, what an amazing background. And then one of the most curious things is so few people have been, have grown up on Roosevelt Island, right?
That is true. A lot of weirdos. Grew up with one of the founders of Kickstarter, actually. I like to think there's something about playing Manhunt on an island in the middle of New York City that maybe breeds, I don't know.
That is so interesting.
You fill in the blank.
That is so interesting. That they have interesting co-founders. I interviewed Yancey on the podcast.
Yeah.
So this is probably one of the other.
Yeah, Perry Chen. Yeah.
Got it. All right, wonderful. All right, so but tell us what is Epibone? Tell us more about the company.
Yeah, we take stem cells, which are what grew our bodies in the first place, and repair our bodies every day, and we use them as an ingredient to make living anatomically precise bone and cartilage. So we combine digital fabrication with stem cells. We take CT scans so that we can extract three-dimensional data and make perfect puzzle piece shaped biomaterials that we call scaffolds. And we infuse stem cells that we either, extract from you, in the case of bone, from your fat tissue, or in the case of cartilage from donors, bone marrow donors. And I think what our secret sauce really is using what we can learn from developmental biology and wound healing, the biology of how stem cells grow our bodies and repair our bodies, and use that as a kind of playbook from an engineering perspective to then design protocols and what we call bioreactors to emulate the natural conditions for tissue development. So that means, the same factors that drive cellular differentiation inside the body drive cellular differentiation outside the body. So our cells almost don't know, are they inside our body? Are they outside our body? So the better we trick them into thinking they're inside a developing, healing body, we can get those cells to make new tissues in the lab. And it's really fun. And I think engineers like myself who studied electrical engineering came into it because we were applying electrical signals to the cardiac tissue or skin tissue that we were growing in the lab, or neuron, cell types that we know are really responsive to electrical signaling. But it also applies in our case to cartilage. We make little robots that deliver mechanical cues that simulate exercise. So we're giving the cells essentially the right diet and exercise to get them to make new tissues. And it's where engineering really meets biology.
Wow, that is fascinating. And Jim, so you've invested in Epibone. What did you see in Nina's vision there?
Well, it's a few things, Jim. First of all, investing is an art, right? I mean, unfortunately, you can't just spreadsheet your way to success because there's so many factors that come in that are completely unanticipated. But I think that, just from the couple minutes that we've heard Nina speak, I think it's clear that she's somebody that has, she's very smart. She's very articulate. She's a, expert in her domain area. I think that, combined with our recognition that there's a real need for what Epibone is developing, and it's just going to happen, right? The days of titanium implants are gone, hopefully. And so this is just a better way.
Got it. And Nina, so I know my mother has two titanium knees.
Sorry to hear about that.
What is the vision, the potential for what you're developing as far as?
Well, I mean, I would love to make titanium implants a thing of the past. 75% or more of us eventually are projected to acquire parts of our bodies that we weren't born with. Bone is the most transplanted human material after blood, and as a society, we're replaced in millions of joints like your mom's, oftentimes because of just a couple of millimeters of damaged cartilage. So why not just take the stem cells that grew our bodies in the first place and repair our bodies every day and use them as an ingredient to make living versions of those replacements. The science is ready to be translated. There's not that many people that can connect those dots, so we're happy to take the mantle and do what we can. But I would, we're moving towards making living joints. That is the future of where we're going. Right now, we're making bone. We're just finishing up our first phase 1/2 clinical trial in humans. So first in human, first in class. So really happy about that. Our second trial that just got greenlit less than 3 weeks ago, okay, is for making what's called an osteochondral graft. That's bone and cartilage together. So that's one step closer to taking bone, layering cartilage on top, making little, from 7 millimeters to 22 millimeter diameter. So getting bigger plugs to replace bone and cartilage in a joint. So you can almost think of that as getting close to a partial joint replacement. But in the future, we want to map that towards making total knees first. We think that's the first joint we want to go after. We can see the path from a scientific perspective, but as Jim knows, and as you well know as well, I'm sure, is that science is just one leg of the stool. You need to have, it's such an interdependent set of issues, clinical, scientific, regulatory, financial, that have to come together in lockstep in order for you to really translate a technology from bench to bedside, as we say in the field, basically from a science project to a science-based business.
Great, and congratulations on that recent announcement.
Thank you.
But what is the optimistic timeline? As far as when will this happen? When can we see these products in people?
Yeah, I mean, that's been, the holy grail for a long time. Tissue engineering was only coined as a field in 1988. But the first now clinical trial for a partial, it's called an osteochondral plug, but for something in the joint that's close to on this path, it's going to be 5 years of clinical trials. Bone has only one more trial left to go, or, 1 or 2, but, less than 5 years. And osteochondral, 5 years on the low end, but probably a good estimate. Now, if certain things happen, like if the regulatory agencies get more familiar, because we were the first and now second stem cell-based tissue products for the FDA to ever approve, right? So for clinical use. So as the FDA becomes more familiar with these types of products and becomes more standardized with the types of outcomes that they're looking for, I think it could smooth that process and make it go a little bit faster. But we're pioneering that. So I think we just have to be really upfront with people that once you're in clinic, and it takes 20 years to get to clinic, but once you're in clinic, it's about a 5-year road, and that's pretty well paved.
Wow. Okay, great. Jim, so obviously you see the vision. This is exciting. But you've been investing for a long time. Have you seen companies similar to this, or obviously this is super exciting, but how does it fit into your vision of your investing sort of thesis and your vision of the future?
Yeah, that's a great question, Jim. So I would say this. So, we talked about the length of time that it takes to get through the clinic. And I think that's a good thing because candidly, where there's my knees, right, my neck, my back, I got my own share of joint issues. And so I'm delighted as a prospective patient that, that the FDA and that Epibone and that we're going to take our time and make sure that it's done right. I'm thinking in the 2005 timeframe, there are a lot of lower lumbar and even cervical replacements, and they didn't work. It's kind of a first generation thing, and that's just how the world works. I remember with I think it was monoclonal antibodies, but there's just a whole sequence, right, of trial and error. But in terms of the vision here, from an investment perspective, the people that have entrusted us to make a competitive return on their hard-earned capital, myself included, because I've personally put a lot of money into this fund. At some level, you're indifferent, right? Because there's all different types of innovation that could be invested into, right? And ultimately, as you point out, Jim, it's a question of getting a return on your investment.
Yeah. And so as far as investing, give us an update on where you are. You're on the second fund, and is there a raise for another fund? Just so people know, you guys are one of the leaders in the region. So give us a sense for where you've come and where you're going.
you're right. We are one of the leaders in the region. We've had investment. We've been lucky. We've had investment returns among the top 1% in the United States based on investment return. And, this second fund may even exceed, the prior, right? Thanks to Nina and a bunch of others that we are working with. So, to me, that's the kind of the exciting part, right? Is, working with Nina and with other companies to change the world.
Yeah, no, 100%. So obviously there's a lot of hype around AI, a lot of interest. How are you as an investor who's seen a lot over the years, how are you seeing those trends around that? And are you investing in AI related companies?
Well, so I guess I am a little skeptical, right? I mean, maybe not entirely surprising. I've been doing this for 3 decades. Recall that I come out of Silicon Valley. I was at Oracle, and I actually got hired into this industry from the perspective of evaluating the technology underlying some of these companies. This was back in the day of client server, right? Counting packages and others. So there's always a hype, and I remember a while ago it was solar, and then of course it's been digital health more recently, but there's always going to be some net, right? And it was crypto, and right. So there's always something that's kind of the media darling. But I mean, from the investor's perspective, I try and look at it as, who are the customers? What are their problems? What are their pain points? And is the solution, whether it's Epibone or others, being done in a way that's going to solve their problems in a sustained way, where there's IP protection and where you can do it, cost effectively? Because those are some of the ingredients, for a successful startup. And we've had 5 companies, Jim, that today trade on NASDAQ or New York Stock Exchange, including companies that are worth billions. But that's kind of the commonality, is getting back to the customer.
Yeah, no, I hear you. But as far as the landscape right now, are we still in a depressed phase where there's not a lot of investment going out? How are you seeing it as far as over this timeline of period?
Well, yes, you are correct. Right now, absolutely, it's a depressed period of time. If you're an entrepreneur and you're trying to raise money, or if you're trying to sell a business, you're 100% correct. But it does depend too on the sector. There's some sectors. I read this morning there was a company that was doing some carbon material related, and they just raised $40 million. So it does depend on the category, and it also depends, and maybe this is the most important, on the relationships, right? So if you have relationships with people that you've worked with, then attracting that capital is easier because there's a trust.
Got it. And so, Nina, you've obviously been very successful in raising during this time period. What are you seeing as an entrepreneur, in the biotech field, right? Going forward?
I mean, I just have to echo what Jim said. I think, in a market like this, you have to go back to the fundamentals, and, people aren't going to bet on, you want a surer bet, and what are the ingredients of a sure bet? I think, you got to look at what is the phrase? There's the horse, there's the jockey, and there's the race. Is there, what he was talking about is there a customer? I think that, are you going after a market that makes sense? Is the team is like the horse, right? Like, is the team the right team that's going to get you there? And then, is the jockey the right person to be riding that horse? And I think I like the fact that, and I also want to echo what Jim said. I like that this is a hard path. One of our corporate, mottos is the high road is the fast road. By doing the hard thing, by not trying to take a shortcut, by not trying to pull a bait and switch with the FDA and saying, I'm going to just try and skirt under the radar with this product and, not really give the full solution that the patients need. I don't really believe in that. I guess maybe that's my engineering kind of, scientific kind of pride speaking, but I also think it's very practical, because all of that difficulty, if it's warranted, okay, if you've got a good product market fit and it really makes sense to do the hard thing, if you do that hard thing and you do it well, and it's all about execution, right? You can publish your playbook. that's a moat. That is barrier to entry for other people. And so I think that it is good to do the hard thing. I think that to the effect that to the extent that you reflect the fundamentals of product market fit and you're going after it with the right team and the right person as the captain of the ship, and you're constantly reevaluating those questions. I always ask myself every board meeting, would I fire me? Would I hire me? I don't think that's just my insecurity speaking. I think it's something that I should be asking myself, because there may come a time, and this is one of my favorite classes that I took in business school, was about executive leadership and thinking about the relationship between the board and the CEO. And there's different archetypes of CEOs that are good for different parts of the business life cycle. But I think it's always important for me to be asking myself, am I the right jockey? Is this the right horse? Is this the right race? And if to the extent that you can stay present with that and kind of take your ego out of the equation and just think of yourself as just another part of the puzzle, I think that's the way to make sure your fundamentals are right and not wrapped up too much in your own ego or the politics of what happens when egos come together.
Got it. No, that's great insight. Now, what about the market overall? Jim, you've seen over the years the shift of VC and investments from Silicon Valley to New York to Boston to other places. Now, post-pandemic, two things: investing in general, the funds, the flow of funds to the rest of the country and the world. Is that how you're seeing that? And specifically for biotech, right? I mean, we've seen, I think, growth in this region. But speak to those two things, Jim first, and then Nina.
Yeah, so I would say that there's a lot of capital. I remember in the 1990s, Jim, I heard John Martinson, at the time the founder and the managing partner of Edison Venture Fund, saying that there's a lot of different sources of capital. And this was back in the mid 90s. Which is a very different world than today. But he's right, and even in today's even more so, right? There's just a lot of different places to attract capital, and if at various points in my career, I've contemplated becoming an entrepreneur, and I would say to myself, just like when Nina said, well, am I doing the right thing as the CEO? I would say, well, what would I want as a financial partner? And I think, the answer is that you want somebody that knows the business, that can be value add, that's committed, ideally that has deep pockets, right? And you could identify some other criteria. But I think, again, to your question, Jim, the reality is that in today's, internet world and Twitter and everything else, you can circulate business plans instantaneously. But I think at the end of the day, it's still about people that are going to roll up their sleeves and be helpful in terms of a partner. So yes, you're right. It is a difficult climate to attract capital, and I got to say, I couldn't be more impressed with, how Nina is pursuing attracting capital, right? Not just, geographically, but in terms of, being very selective, and very successful at attracting terrific organizations and people. So yeah, it's difficult, but there's a lot of capital. To some extent it's fungible, but to another extent, it's a critical job to find people that believe in what you're doing and that can be part of the team. Got it.
Nina?
Well, now I've forgotten what the question is. But
biotech investing. As you look to raise money, right? There's other places in the country you could go, but obviously you didn't need to go to other places in the country. Talk to us about how you view that investment landscape.
Okay, right. Well, I do want to echo what Jim said. I think, when there's an up cycle, there's down cycle, there's always winners and losers, which means there's always opportunity. And so I think it's important to, hold your finger to the wind and figure out, well, where are the winds blowing? To paraphrase Wayne Gretzky, the, hockey player, you got to skate where the puck is going, not where it is right now. And so I have been very blessed to work with someone like Jim. I mean, I've always told Jim, I feel like, what would the industry look like if there were more Jims? People who were willing to roll up their sleeves and really get together and really think through the hard questions and not just be a Rolodex and be a person that shares things around, but actually is a thought partner. But we haven't been extremely local, actually. I love that Jim is local to us because it gives us a home base, especially now in New Jersey. And it's been just so helpful. I think he's really helped me see how the Garden State is a great place for biotech companies like us, by helping me get integrated into NJ Bio years in advance of our move, actually. But we have global capital. I like to say we have capital from every continent except Antarctica. And we've had global ties since day one. I mean, our first check that I ever deposited into the bank was from Ratan Tata, who is the former chairman of the Tata Group in India. And I love that. I love that my co-founder is Thai and that we attracted investment from Thailand because of him, and that we had, Latin America. And I loved, because I want to be able to tell the story through my investors as one bucket of stakeholders. That we know that the US isn't the only place. The US is the largest market, but it's not the only market. And that we don't want to make a product that's only available to eventually downstream to the privileged few. We want to make the case that personalized medicine and living therapies are more capitally efficient and therefore globally viable than just, we're going to go after a niche of extra privileged 1%ers and, potentially the most wasteful, healthcare economy in the world, right? So we've gone to Asia Bio and cultivated folks in Singapore, because Singapore is very well known globally as fostering the life sciences and biotech, and also positioning themselves as a regional hub in Asia. India is the largest country now in the world. I love that we have investors there that can help open doors. But we are focused, like to your earlier point about doing the hard thing. I like that we are in the most difficult regulatory environment, because then that becomes an exportable, asset. To be in the hardest place, to never get accused of going to Thailand or going to one of the countries that we're affiliated with or have a citizenship in. I'm a non-resident Indian citizen. Ik, my co-founder, is Thai and also an American citizen. I never want to be accused of, oh, you're just going to this country because you're trying to sidestep some use human guinea pigs or do something cheaper or do something, the high road is the fast road, but that becomes an exportable commodity, an exportable asset. So I love that we're in the US first. Now that we're getting our first safety trial under our belt, I want to move around and start to cherry pick good ex-US geographies. And that is also reflected, not just, that's reflected in the way we think about clinical, it's reflected in the way we think about investment as well.
Got it. So speaking of investing, there's a lot of entrepreneurs listening in. Can you share one tip for entrepreneurs who are fundraising right now?
Is that for me?
Sure.
Well, I guess my tip would be just going back to this metaphor of ask yourself, am I telling a story in which the race is worth running, the horse is going to win it, and you're the right jockey for that horse? And if you're the CEO, you are de facto just one person. So you are going to not be you might be a Swiss Army knife, but you're definitely not all things to all people. So if you take the tack of, again, taking your ego out of the equation and saying, what are my strengths? Let's play to my strengths and let's fill my weaknesses on the horse, not on me. I'm not trying to fix myself. I'm going to play to what I'm good at, because I'm an engineer. I believe in the power of positive feedback, whether it's control systems or psychology. I'm going to play to my strengths, and I'm going to fill my gaps on my team and make sure that horse is worth running, and reevaluate that at least every 6 months. And I think if you reflect the fundamentals and the race is worth running, your horse is the right horse and you're the right jockey, I think you can win. Because there's winners and losers in an upturn. There's winners and losers in a bear market and a bull market. Just go for it and make sure you reflect the fundamentals. And I believe that those will carry the day.
Got it. Jim, what do you think?
Yeah. So listen, I couldn't agree with what Nina just said. I'll say two things, Jim, to entrepreneurs that might be listening. So one is, I think that what Nina just said about the complementarity of a team is very important. We had a company called InstaMed, and they had two co-founders, Bill Marvin and Chris Syme. And Bill was marketing and sales, and Chris was technology, and they were complementary, and they were both terrific, and they were able to build on each other. And then, of course, they recruited and brought others in. But to what Nina just said, there's a complementarity to the team. So it wasn't just trying to be one person, because you can't. No matter how talented you are, you can't do it all. But the other thing, Jim, to your question, about a tip for biotech, listen, it's hard. Every day is hard, right? That's just the reality. And there's a reason that just a very small fraction of companies, end up being successful. But I would say that, that Winston Churchill's comments always stayed with me. Somebody said, are you a pessimist or an optimist? And he said, well, I'm an optimist, because why would it be anything else? Right? It's to my advantage to be optimistic. So I think, in the context of being entrepreneurial with all these challenges and difficulties, that, seeing the positives.
Great. Thanks, Jim. And Nina, what about for biotech entrepreneurs? Any tips specifically?
I don't know. I feel like I don't want to repeat myself, but and specifically for biotech, science matters a lot. And what is the novelty of what you're doing matters a lot. So, to the extent that your intellectual property is, it's a reflection of your innovative capacity. It's a reflection of the innovativeness of your approach. It's also your number one asset. So I think it's even more important to have IP than for other types of businesses.
Got it. Jim, any other quick tips just for biotech entrepreneurs?
Well, I think motivation gets you started, and then positive habits gets you to where you want to go.
Got it. This has been a great conversation. We usually end with a poem or a saying. Ladies first. Nina, why don't you share what you have for us?
All right. So I'm just going to preface this by saying I am not a poet. But I do occasionally do art therapy, which involves writing. And so I'm going to read a haiku that I wrote about cells. And it's on my Twitter from many years ago called #CellHaiku. So here goes. I never have read this out loud. Okay. So our ecosystems, so many cells inside us, our ecosystems. And what that means to me, and I think that's probably why I said so much about ego on this call, is that I think it's really important for us to remember we're all made out of cells, trillions of cells, and they all have their own consciousness to a certain extent. And that's what we leverage at Epibone, is the genius that lives inside all those cells. But those cells comprise who we are, and it's kind of miraculous that our heart beats and our breath breathes and all that good stuff, powered by cells.
That's beautiful. Guys, thanks so much for joining us today. Thanks for joining us. I hope you enjoyed the show. Please like it, leave a review, and subscribe. See you soon.